For those who tune for the first time, I am Dr. Francisco. I am a specialist nephrologist and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help people with kidney problems or their relatives to understand better their disease so they can manage better by themselves or with their own doctor or with me if they choose me, so they can minimize complications and worries. Today's topic is kidney transplantation the best option for everyone with kidney failure? So kidney transplantation can prolong the length of life of patients with kidney failure in comparison to patients undergoing dialysis. Said that, we mentioned that that is true when the outcome of the bulk of patients undergoing kidney transplant is compared to the outcome of the bulk of patients having dialysis. We have previously also commented that kidney transplantation brings along many other advantages over dialysis. However, we also discussed that every patient is different, that there are always exceptions to those statistics, and that decisions must be individualized. Especially when I mentioned that transplantation is not free of side effects or risks. For all that, the short answer to today's question is that overall kidney transplantation is better than dialysis for the standard risk patient. But it might not be the best option for all patients with total kidney failure, especially if they are elderly, frail, and fragile, or have multiple or significant diseases like heart disease, lung disease, or cancers, among many other conditions. I am mentioning some examples only. I'm not being exhaustive, and every advice needs individualization, as I always mention. Kidney transplantation is a major surgery, so patient has to have certain degree of general and cardiopulmonary fitness to go through the surgery safely, with minimal or acceptable risk to minimize complications or risks to his or her life. So you have to be relatively strong. We mentioned that one of the common side effects of the immunosuppressive drugs used in kidney transplantation is a heightened risk for infections. So patients with chronic, active, or severe infections might not be good candidates for kidney transplantation. For instance, people with active tuberculosis or relentless blood infections like fungi. Likewise, the use of immunosuppression in patients with active or recent cancer is not ideal. So, for these patients, kidney transplantation might not be the ideal option. Therefore, for many of these patients, transplantation can be in fact an inadequate or riskier option. And in fact, dialysis could be the best option over transplantation for them, as kidney transplantation can bring along more problems than benefits. The extreme of these is those very ill or debilitated patients. Their surgical risk can be simply unacceptable, with even high risk of perishing during the surgery. Or patients with short life expectancy, like advanced end-stage disease of other bodily organs or advanced cancers, which can have either a high risk for cancer progression because of the immunosuppression we use in kidney transplantation, or simply kidney transplantation will not bring along many benefits or will not make a difference at all over dialysis because the cancer is already too advanced. And sometimes dialysis or just focusing in comfort measures suffices for these patients. There are many other medical situations for which kidney transplantation might not be an option. As I mentioned, medical advice needs to be individualized. And also there are different degrees, for example, of heart disease. So patients with mild heart disease might be able to undergo kidney transplantation with no major issues. Obviously, after thorough assessment by specialist cardiologists. Some patients might have psychiatric problems or dementia, and therefore they are unable to understand the rationale, pros and cons of kidney transplantation, or unable to take care of themselves after transplantation. And many doctors believe then that kidney transplantation is not the best option for them. In addition, many experts believe patients that are known not to take their medications properly, they miss medications or they don't take them at all, or they don't attach to medical follow-ups and checkups, propitiating complications or missing something that could have been detected on time. Many experts believe that they are also not good candidates for kidney transplantation, as immunosuppression needs to be taken sort of religiously to prevent kidney transplant rejection and prevent eventual loss or premature loss or undesired loss of the kidney transplant. And also frequent checkups are necessary to ensure the patient's and the transplant's well-being. There could be also some social and situational characteristics of certain patients preventing them to be candidates for kidney transplantation. They can be financial, for example, having no insurance or enough finances or subsidies, or even having no donor or having no suitable donor, for example, not fit medically, or having no willing donor, a donor that is not keen to donate or afraid to donate. So indeed, for people who doesn't have the money, the insurance, the medical team, the medical facilities, the donor, then for them, transplantation is not an option. They need to go for dialysis, yeah? Obviously, when kidney failure is acute, so it's maybe just something happened to the person and it's not total kidney failure and is therefore potentially reversible, kidney transplantation is not an option, at least at that junction. Well, we don't know if it's going to be a permanent problem or not. And as I always mention, this is more complex than on this. And these discussions and advice must be individualized to your particular medical situation, preferences, and priorities. And although the content of this video is a little gray, a little bit dark, because we have been discussing some negative issues or contraindications for kidney transplantation, it is true that many patients have them, and it is true that kidney transplantation is not the best option for everyone and for many patients. But said that again, and if you remember my previous video, most patients are indeed suitable, and overall, kidney transplantation is a better option with greater benefits in comparison to dialysis. So if you indeed have the chance and the option to have a kidney transplant, consider kidney transplantation as your first option over dialysis, especially if you are young or relatively young, if you are fit, strong, active professionally, socially, and or intellectually, a family to provide to, or wanting to form a family, and if you have a strong wish to live for as long and as better as possible, or you have high expectations from life, you still have many dreams to fulfill, and you obviously are medically fit after thorough assessment. But for most patients, kidney transplantation is the best option, and most patients are actually fit, but they need to be subjected to thorough medical assessment and many other evaluations. But especially if you are young, strong, you still can work, you still can help people, help your family, you still can enjoy life, you can still do many things in life, definitely you should go for kidney transplantation if it's a viable option and you have a willing and medically fit donor. But please discuss all this in more detail with your own doctor, or you can discuss it with me if you choose me as your doctor, no? In Francisco Kidney Medical Center, we provide our patients and their families with the rationale, pros and cons of all these therapies and issues in an individualized manner. And we weigh all the options for them so they can take the best possible choice, taking into account their own condition, preferences, and priorities in life. If you need our help, just contact us. There are some ways, because today I'm using my mobile. For whatever reason, I could not use my computer today. The live option was not there. So I'm just waving. Any comment, I will answer later. So I am Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.